ARDS, Acute Respiratory Distress Syndrome. In this disease, which is very life-threatening and it is an acute emergency, there is accumulation of exudate in the alveoli, due to which process of gaseous exchange is disturbed and reduced to a very dangerous level. So these patients, they are mostly kept in intensive care units in the hospitals, and artificial oxygenation is required. In this disease, the exudate fill up the major portion of the alveoli, which are responsible for provision and absorption of fresh oxygen from the air inhaled into the capillaries, that is into the blood. So in this disease, there is hypoxemia, hypoxia, and hypercapnia. That is, the oxygen level in the blood is reduced. So hence the supply to the vital organ is reduced. They are not sufficient for the normal functioning of the body. So it produces an alarming condition and dangerous one to the life of the patient. Basic or the first steps, when there is a exudative stage or the proliferative stage, the symptomatic treatment is performed even outside the hospital, at home. That is, antipyretic, analgesics, and antidepressant medicine they are used to alleviate the temperature, fever, and the pain, the chest pain, by the NSAID medicines and the acetaminophen. These are used ones. And the other anxiety relieving or the antidepressant medicine they are advised. But when it is a critical state that needs intensive care unit treatment in the hospitals, so for that one's patients, artificial respiration or oxygenation is required. That is called as supplemental oxygenation. So for that, initially, mouth or the nasal masks, they are used to supply the oxygen directly into the lungs. Next, there is, when the condition is very serious one, so to save the life of the patient, that is, the mechanical ventilators are used. So the ventilator is a device that produces, that provides the oxygen and convey it into the, through the airways into the alveoli of the lungs, from where it is absorbed in the blood. So the tubing or the connection is directly fitted through the airways into the lungs. So this ventilator supply fresh oxygen outside, from outside directly into the, the alveolar region or the portion or the parenchyma of the lung. Mostly it also absorb or the extract the fluid accumulated in the field, the functioning field of the lungs, alveolar region, from the lung outside. When the person is in the final state, that is fibrotic state, so for that one, we have to provide hard lung machine, which is called, procedure is called ECMO. For that, the rest is given to the lungs and the blood is circulated outside into the machine that purify the blood, add up the oxygen in the blood required for the body and extract the carbon dioxide from the blood. And then this fresh blood laden with oxygen is then recirculated into the body. So it is a mechanical, the artificial heart lung machine to provide to purify the blood that extract the carbon dioxide and the addition of the oxygen from outside into the blood, and then that blood is recirculated in the body. So it is a life-saving process and procedure one. For preventive measures, quit smoking, and then patient or the person must be immunized. The essential vaccination is required for every person. Excess of alcohol is prohibited. So during this artificial procedure, prone position is as white. Prone position of the patient is required because that filtrate the excess of the oxygen to the alveoli easily. This is prone position is the requirement.